Welcome to the information session for the medical assistant program. If this is a program you're interested in learning more about, you are in the right spot. As a housekeeping note, this session will be recorded when we start, so feel free to turn your camera off, but I'll still be here and I'll be joined by a few guests along the way. I'm also joined by some of the Skills Initiative staff on the recruitment team, which you'll meet a little bit later on as we start to interact towards the end of the session, and you'll meet some of our training partners as well. At the end of this session, we'll have that time for open Q&A. You can save your questions till the end, or as I'm going through this presentation, feel free to drop those questions in the chat. Hopefully I'm answering them throughout this presentation, but our recruitment team will also be managing the chat, collecting those questions, and then at the end, we will ask those questions to myself and other staff to be able to get you the accurate answer. And with that, let's get started. My name's AJ Adams. I'm the Director of Strategic Partnerships for the Skills Initiative. I lead our business engagement work and build programs like the one that you're about to hear about. I'm also joined by Mimi, who is our Manager of Data Quality for the Skills Initiative, who will be supporting me today. I'd also like to welcome in Kim from American Training Center to do a brief introduction.
Hi, everyone. I'm Kim Rahman, the co-founder and president of American Training Center. We specialize in training frontline healthcare workers. Nice to meet you all.
Thanks, Kim. So where are we at and where are we going? We're going to cover a broad scope of things today. You're going to learn about American Training Center and the Skills Initiative and how we do our work over a really long history. You're going to learn about who Penn Medicine is. Most importantly, you're going to learn about medical assistant roles and in that role, what your responsibilities are, some of the great things about the job and some of the challenging things about the job. We'll talk about the program schedule and the commitment that you need to make in order to participate in this program. And then we'll talk about the application process. Wherever you are in that application process, we'll tell you the tips and tricks in order to continue to move through that process and ultimately be selected for this program. Great. So who's the Skills Initiative and how do we do our work? Ultimately, the Skills Initiative uses a cohort-based training model where we work with one participant for one job opening. In this case, ultimately, we're working with Penn Medicine for identifying candidates for a number of medical assistant positions. When we build programs, we infuse our professional development curriculum and then customized solution, which includes working with folks like Kim at the American Training Center to implement medical assistant coursework and get you that certification that you need in order to connect to your job. With that, I'm going to kick it over to Kim to talk a little bit about American Training Center.
Thanks, AJ. So American Training Center is a career technical school, and we specialize in medical assisting. So you can see on here, we just hit the 800 mark. So that was an exciting moment for us a few months ago. We've trained over 800 medical assistants and certified nurses aides since 2018. We've been doing this for a really long time, have set up an accelerated program. You may have heard programs that are 9 months long, 18 months long. We worked with employers for a long time to really say, what is it exactly that you need for folks to have to be able to come in and successfully be in these jobs? So over that period of time, we've developed this nice accelerated program that I'm really excited to say also has very high completion rates. So as you can see, we ride still at about a 96 program completion rate. Usually folks who can't finish that's more about personal life or something came up that was unexpected. But we've really created a supportive setting with small classroom sizes. Usually never see more than 14 students in a class, which means you're really a person. You're really a student there. You're really connecting with your instructor, getting a lot of individual and hands-on attention with your instructors. We also like to say, 87% of our students go for multiple certifications. In this program, you'll have the opportunity to go for 2 certifications of this, I always get it, clinical medical assistant certification, and then also the phlebotomy technician one. So a lot of our students, you can tell it's a real growth mindset. They want as much opportunity as possible, and they complete multiple certifications. That's a little about us.
Awesome. Thank you, Kim. And a little bit more about the Skills Initiative. We design and run programs which connect you, the job seeker, to the tools and supports needed to build a career that's meaningful for you. We run lots of programs with lots of different partners. And if you're interested in working with Penn Medicine as a medical assistant, this is the right program for you. But again, we run lots of programs with lots of partners for lots of different positions. So if this one isn't the right one, there will be another one in the future that may be more aligned with your career path. The Skills Initiative team engages employers in order to understand the workplace culture, the hiring practices, and turnover issues, and we develop those customized solutions like this MA program to meet Penn Medicine's needs. We support businesses to connect talent, to connect them to the talent they need while changing traditional hiring landscapes. We train and connect Philadelphia residents of full-time and permanent employment, and we fill vacancies with productive and motivated workforce professionals. Lastly, we work directly with employers like Penn Medicine and directly with participants like you all who are looking to connect to this program. Our job is to connect employers to the talent they need and participants to the opportunities that they're most interested in. And how do we do this work? Ultimately, our goal is to match employer needs and job seeker needs. We build those customized programs like you're going to hear about today, and then we spread the word to our community as far as we can. We want Philadelphians to know that this job training program is available to them, and these job opportunities are available to them to connect to through short-term training programs. So we spread the word through information sessions, social media, elected officials, different organizations, letting folks know that they can connect to job opportunities right here. And then the best part of Kim and I's job, we make those successful matches. Ultimately, first, identifying quality candidates to participate in the program, and then those candidates that graduate, connecting to those opportunities with our employer partner. The next thing that we're going to do is learn a little bit more about Penn Medicine. I'm sure many of you on this call are like, yeah, I know who Penn Medicine is. But we'll dive a little bit deeper. We'll talk about who they are, the need for medical assistance within that healthcare network, and also some of the great things about working at Penn Medicine, and some of the things that you should be aware of as you're thinking about this career path. So we build great results by working with great partners. Let me tell you a little bit about our employer partner at Penn Medicine. Penn Medicine is dedicated to the mission of providing the highest quality of care to patients, conducting innovative research, and educating future leaders in the field of medicine. Working for this leading academic medical center means collaborating with top clinical, technical, and business professionals across multiple disciplines. Today at Penn Medicine, someone will make a breakthrough, someone will heal a heart, deliver hopeful news, give comfort and reassurance, and the Penn Medicine employees shape the future of each day. There are over 250 practices in the Penn Medicine system, and every practice is a little bit different. They have different departments, different procedures, different leadership styles. So there are many ways to get the work done and a lot of specialties to attain in order to connect to these opportunities. About the medical assistant role. You can see on the left side of your screen some of the great things about being a medical assistant, why we believe it's a quality job by every metric, and a little bit about what medical assistants do. They'll greet patients, they'll room them and do check-ins. Those could be things like review health history, reasons for being there today. They'll check vital signs and height and weight. They'll ask health screening questions. They'll check for risk of depression. And they're a key role in building a quality rapport with patients, even in the midst of a fast-paced work environment. Medical assistants also huddle with other medical providers on staff. They look for care gaps, they review patient needs, they're assisting with procedures and preparing instructions for follow-ups and next steps. Those medical assistants must be able to learn the Epic electronic medical record system upon hire. Many of you in this info session now probably have some familiarity with that Epic electronic system. They also spend time prepping rooms, sterilizing equipment, and ordering supplies. Through our work with Penn Medicine, they've named that employees who succeed in this role are go-getters. They take initiative, they ask questions, and they pay attention to detail to ensure processes are followed correctly the first time. Some things that you should be aware of as you're thinking about both this program and job opportunity being the right fit for you. You'll need to be able to meet the demand of the things that are listed on the right side of your screen. And there's some other things that we'll talk to you about along the way, which will include proofs of your annual TB test and immunizations, and you will need to pass a drug screening if and when you're extended a job offer with Penn Medicine. So next, we're going to talk about the program commitment and the calendar overview. This is a 13-week training. It is February 6th right now. This program is set to launch on February 24th, officially on the first day. And throughout that 3 weeks will take us to May 23rd. Ultimately, you could think of this program broken down into 3 different parts. 2 weeks of professional development with the skills initiative in person every day in West Philadelphia, 9 a.m. till 12 p.m. Then you can imagine 8 weeks of hand-on medical assistant coursework with American Training Center, also here in West Philadelphia. And those will be Monday through Friday, 9 a.m. till 2 p.m. And at the conclusion of your medical coursework and obtaining your MA certification, you'll then connect to Penn Medicine for a 2-week externship. At that point, you'll work roughly 40 hours a week, 7:30 a.m. till 4:30 p.m. Each practice is a little bit different in terms of the timing and commitment, but it's really this opportunity to learn on the job, to understand and show what a great employee you can be through that externship opportunity. During that time, you'll switch from the $150 weekly stipend to a $14 an hour pay rate during the externship period. Ultimately, those folks that complete that externship will have the opportunity to connect to full-time permanent employment at Penn Medicine, starting at $21.50 an hour. For our folks who need a different visual about what the cadence of this will be, Kim and I are going to walk you through what the calendar commitment looks like week by week. So again, it's February 6th right now. On February 20th, we'll make final selections and we'll invite folks to what we call our participant agreement meeting. In that participant agreement meeting, we dive deep into the standards and expectations of the program and ultimately review the calendar and what the commitment needs to be in order for you to participate. And we kick it over to you. Ideally, you say yes. Of course, AJ, this is everything that we've already reviewed. I know what I'm getting into, and you sign that agreement. At the point that you sign that agreement, we'll give you all the first aid details for in-person professional development happening on February 24th. The skills initiative will lead that professional development, and we'll talk about things like growth mindset, support systems and coaching, personal branding, effective communication, and feedback and goal setting, all in context of working at Penn Medicine and in the career as a medical assistant. Our goal is not only to give you the professional development that you need to succeed throughout your life, but also give you the job readiness and realistic job previews that you need to be successful at Penn Medicine. At the conclusion of the 2 weeks of professional development, you'll then transition to the American Training Center to start completing your medical coursework. And that's where I'm going to invite Kim to join me to talk a little bit about what that 8 weeks looks like.
Thanks, AJ. So when you hit the coursework period of your programming, we have designed it to be as real life as possible. You can picture that, it is, like I mentioned earlier, an accelerated 5 really, really intensive hours a day. You also want to make sure you're setting aside time in the evenings and on weekends to be studying your material. The class, look, about half of your time is spent in the classroom, deep diving into your books, or I call it, into your ebooks and into the electronic learning platform, along with a live instructor. It's very live. So, but there are also resources that they utilize in the classroom that make it very interactive. So it's about half the time is in that classroom, half the time you're in a lab. So as soon as you hit week 2, where you're learning infection control practices, all the safety things that you need to be in a lab, you really start practicing things hands-on right away. So if we take an example of something that you heard before from AJ, taking vital signs and blood pressure, that's a nice hands-on skill that you want to feel like you've mastered by the time you leave the classroom. So by week 2, you're usually starting to practice your taking people's blood pressure so that you have plenty of practice on that before you graduate. I like to keep using the word intensive because I feel like that's an important thing for you all as you self-screen and decide, is this something for me? Because, it's very intensive during the day. And then, there's that added time at the end, or like that you want to plan for at the end of your day. At the end of the program, there is a national certification exam. So you're really spending your time in class learning all, I'll call it the book side of things, so that you can pass the certification exam. And then you're also practicing and gaining competencies in the necessary clinical skills. So AJ mentioned some of the things earlier, but I just like to really put it out there to make sure at the end, if anyone has any questions about, what exactly, what kind of skills you'll be learning. So really, I like people during this part to picture, if you've ever been to a doctor's office or doctor's visit before, that's the type of role you're moving into. So medical assistants can work at hospitals, they can work at labs. This particular program for this group is to be working in doctor's offices. So if you picture that visit, it's everything from someone making a phone call to get into the doctor's office. You learn on a computer program in your class, how exactly do I schedule a person's visit? How do I go into this electronic system? How do I navigate in it? How am I efficient in it? And how do I interact with the patient to make sure I do everything well and get it entered into the system? So from right up front, all the way through, if you think of then the next step, you get called back to go to the back part of the office when you arrive for your visit. And I'm curious, I know there's a lot of people to do a chat thing, but if anyone's ever been to a doctor's office before and they call you back, what's a couple of those things that the person does that brings you back? Put it in the chat. Just tell me one thing that when you go to that back side of the office. We call it the clinical space. What are some of the things that they do with you right away? Yep, good, good, good. They're all popping up. Perfect. So my absolute worst part is getting my weight taken right away, and I know to expect it, but that's a medical assistant's job. So a medical assistant, they're looking for things, you'll learn how do I chit chat with this person? How am I professional? How do I help the person relax? How do I communicate in a really caring way to help them be calm, to get back to the doctor's office, to meet with the doctor or nurse. We have real scales in the lab that you practice. You'll learn how to do those. You'll learn how to take all the necessary vital signs, how to take people's temperature, how to take their pulse ox, how to do all those things, and then go right into the electronic health system to accurately record that information. So those are some of the basics. It also is a very big part of the program is that you do learn phlebotomy. So you learn it in the classroom first. Your instructor shows you, then you do practice on, we call our fake arms, and you do a lot of practice on fake arms. And then you do transition over and start practicing on each other. So you want to think about that ahead of time. And I can tell you, 90% of people are nervous about that. 10% of people are so excited about it, they can't even contain themselves. But it's normal to feel nervous about that. And I really want you to have confidence that the instructors have taught, hundreds and hundreds of students and really know how to help them get through those fears and move, into being able to practice that in a good way. But you do it's like 20, I think you do 25 or 30, forgive me, didn't put that in my notes, but 25 or 30 live sticks. You also bring in friends and family to practice on. We have friends and family day. We really make sure that you feel really confident leaving, knowing how to practice phlebotomy. Now, interestingly enough, a lot of the positions don't require phlebotomy afterwards. So it is a skill that we like medical assistants to have, but depending on the job you get at Penn afterwards, some offices send their folks over to the lab and you don't even need to, but it's nice for you to have that full experience and know how to do it. The same thing applies for EKGs. So that's a part of medical assisting that a lot of people love. It is pretty
Kim, for some reason you went on mute. I have no idea why.
happened.
There we go. Thank you.
So and some people love that part. It is a more complex part, but you get to learn how to run the machine and actually perform an EKG on someone. Medical assistants don't have to read those, but they learn how to perform them to give that information to the doctor and nurse. So those are some of the big ones.
Not to cut you.
Oh, okay. I thought I heard some background noise real quick. Then,
Yeah,
and then
we had Kim, one moment. Sorry, we did have someone asking a question, but we're just going to ask everyone to save all questions till the end. We just have about 3 more slides to cover, and then we'll open it up to some of those Q&As.
Good. Thanks, AJ. And then just one of the last things I like to mention is you do work on injections as well. So if you've ever been to that doctor's office and learned, or had a flu shot or, anything like that, we don't give those during class, but you learn how to do those on little, fake skins. So just listing all those clinical things mixed with, you learn things that you learn about insurance, you learn how to take a patient account, patient history. So there's a lot of different things, and the class is, really set up where you get to learn about them and practice. So lots of practice in it with the goal of folks feeling really comfortable by the end of those 8 weeks. All right, turn it back to you, AJ.
Great. And Kim, actually, I'll ask you to help me and support this. Could you talk a little bit about what that 2-week externship is like? What's it like showing up at a new practice and the expectation is of an extern?
Sure. I love that part. It's like, I feel like this externship is nice. It's 2 weeks where it gives you a lot of time to go into a real life scenario. So you learn all these things in the classroom. You're in the lab for that full 8 weeks, learning, practicing, doing with your classmates. And then you get to go to a practice at Penn Medicine in one of the doctor's offices and for 2 weeks get that real life experience. I'll say, I love it because it helps people work out their nerves a little bit. And we tend to find that they're really, people in the offices know that the externs are coming. So they tend to, like it. Most of the people that involve, work with externs tend to like to teach what they do, like they love what they do. And so then they like to help someone else. And it really lets you get your feet wet slowly. So maybe your first couple days, they'd let you shadow. So now you're in a real doctor's office where they're providing care, but you get to, for 2 days, shadow another medical assistant and see what they do all day. Then maybe the next couple days, they let you start practicing. So they might let you then bring someone back, bring the patients back, do their vital signs, see what it's like in real life to weigh someone, to do their vital signs, to do their patient history. And people say that the 2 weeks go by really quickly, but you get to practice all the things that you learned. The flip side is it's really nice for the managers as well. The managers then have this opportunity it's almost like a 2-week interview. If you think, they can say, oh, how serious is this person? Are they someone that does take initiative? Are they able to ask questions when they don't remember something? Are they good at following directions? How are they with patients? How are they communicating with the team? So ideally, it's nice. Some of the externships, those offices actually have job openings. So that's nice. That's always a nice win-win, where at the end of that 2 weeks, if there's a job opening in that office, that manager could offer an interview to you. And either way, it's win-win because you get to, both of you get to have that opportunity of learning together.
That's right, Kim. That's what I wanted to highlight too. The externship is a place where you get to learn what your nursing kryptonite is, whether that is eyes, throats, babies, changing work environment, right? But it is this on-the-job training opportunity to make that informed decision that this is the place that I want to be. And ideally, you're externing at a practice that has an opening, and you are showing that practice how much value you could bring to them. And ultimately, that could be a place where you're being hired. As you can see on your screen too, built into the program is an interview day. After all externships conclude, we will get to meet many of the talent teams within Penn Medicine in order to connect to a practice that has an opening. So who are we looking for this program? We're looking for you all, job seekers that are interested in Penn Medicine as an employer and interested in being a medical assistant. You can see this list on your right-hand side of things that we think stand out as characteristics, and some hard things as being a Philadelphia resident, having your high school diploma or GED. But I do want to call out that first one, of having that patient-centric mindset. Over and over, it's echoed through our work with Penn Medicine and building this program, that they are looking for folks who believe in this work, who believe in a patient-first mindset, and believe that they can provide the support to the entire medical system or practice to provide excellent customer service. So those could be things like compassion, good communication skills, digital literacy as you're working with that EPIC system, and ultimately dedicated to timeliness and that learning mindset. Because not only are you going to be learning a ton in this program, you're going to be learning a ton on the job and through that externship. I have just two more things to share with you as we start to round out our formal presentation and answer some of the questions that have been dropped in the chat. We do run a rolling recruitment process, so you could be at any part of the steps that you see on your screen right now. But the first step is ultimately submitting an online application. Applications are reviewed on a rolling basis, and that's why folks could be at different spots on this continuum, depending on when you submitted your application. The application has two open-ended questions that are weighted heavily. Why do you want to participate in this program? And what additional qualifications are you bringing? Those additional qualifications could be medical related, they could be customer service related, or they could just be a passion for helping people. That's what we want to hear from you. What makes you unique and what are you bringing to this program? Those folks that submit strong applications will then be invited to our assessment day. We use an assessment called CASAS, C-A-S-A-S, and we institute a math and reading assessment, looking for folks who can meet a baseline aptitude of reading and math. Those folks that meet that baseline are then invited to submit interview and screening Those folks who pass that assessment are then invited to an interview and to submit screening documentation. That screening documentation can things be like your state issued ID, your high school diploma and GED, and some other things that our team will share with you. And that interview is really the last step in this process before being invited to that participant agreement that I've mentioned before. That participant agreement meeting is really about you, the participant or future participant, making an informed decision that this is the right opportunity for you. We'll share those standards and expectations with you and the calendar commitment that Kim and I just reviewed. And ideally, you're saying yes at that point. Once you say yes, you sign that agreement, we will give you all of the first aid details for professional development and prepare you for that technical training at American Training Center. After you complete that professional development and technical training, we will then work with Penn Medicine in order to match you to that 2-week externship site. Again, I just want to mention that these are rolling applications. So if you haven't heard anything yet, we're only 2 days into our recruitment process. We're still reviewing applications, and we'll continue to do for the next week. This application will close next Tuesday. So there's plenty of time to submit a high quality application and start moving through this process. The last thing that I want to share is, what do you get from this program? You get a lot, right? You get connected to this custom program built in partnership with Penn Medicine and American Training Center in order to connect you to an opportunity that maybe you've been interested for a long time. Maybe you've even applied before and haven't been able to break through to be hired. This is a program that allows you to do that. And throughout that 13 weeks, you'll connect to medical assistant coursework that's absolutely relevant to Penn Medicine and more broadly, medical careers. You'll work with the Skills Initiative to go through our signature professional development series to not only prepare you for roles at Penn Medicine and working in a large healthcare network, but you'll learn tips and tricks and skills that'll prepare you throughout your personal and professional life. You'll get that hands-on training at ATC, and you'll also have that employer-specific externship, which is really a hallmark of this program. You're going to have the opportunity to work at a practice and ideally be hired by that practice because of the dedication that you show during that 2 weeks. The Skills Initiative and American Training Center will provide you all the onboarding supports you need to transition to your new role, and should be really seamless. We'll be completing some of those hiring milestones during the program so you can connect to your new position as quickly as possible when the program ends. Throughout this program, you'll be earning some monetary dollars, including $150 weekly stipend for the first 11 weeks. And then during your externship, you'll turn to a $14 hourly wage for the time that you're spent with Penn Medicine. You'll also learn many new professionals along the way. You're going to expand your network personally and professionally, working with both the Skills Initiative and ATC teams. And then lastly, you'll get connected to an industry-specific professional coach who will not only help you throughout the 13 weeks of the program, but will stay connected to you as you transition to your new career at Penn Medicine. I've said a lot. Kim said some things. You're probably sick of hearing me talking. You probably have burning questions. So I want to call out one last thing for you before we open it up, which is if you're interested in applying or learning more, you can go to our website, philadelphiaskills.org/jobs. You will see the medical assistant program posted on there, and you can take the steps to apply. Also, I want to call out before we open it up for Q&A and review the chat questions. If you have a very personal or individual question that you don't feel comfortable voicing right now with a large audience, please use the email address that you see on your screen on the bottom right there, the hello@philadelphiaskills.org, and send us an email. We have an entire recruitment team that is managing that hello@ email address, and we're going to get you an answer in a timely fashion so you can make the best decision for you.